Okay, so picture this. You're abroad, right? You're finally on that dream vacation, maybe exploring a new city, and then boom, you have a medical emergency.
Ugh, I can't even imagine.
Right. It's stressful enough at home, but in a completely different country.
Exactly. And that's why today we're going to dive into what happens when you need emergency medical care, specifically in a private hospital in Mexico.
Perfect. Because I know a lot of us travel with insurance, but
Yeah.
who really reads all that fine print? We
Uh-huh.
don't know what to expect when it comes to actually using it.
Exactly. So we're using the insights from Brett LaMar. He's an XP and health insurance expert down in Mexico to kind of walk us through this whole process.
Awesome. So, okay, let's say we're in Mexico and we need to go to the ER.
Okay.
What's the first thing we got to do?
So the first thing Brett really emphasizes is being prepared. So he says you'll need your ID, your insurance card, and a physical list of medications and allergies.
Okay, so it's interesting that he says a physical copy and not just like on your phone or something.
Yeah, right. Because in a stressful situation, especially in a foreign country, like the last thing you want to be doing is like trying to fumble with your phone or worrying about a dead battery.
Right, or if you don't have internet or anything like that.
Exactly. So just having it all printed out can really, really streamline the
That
process.
makes a lot of sense. And, sometimes those hospital forms can be really long.
Oh, yeah, for sure.
So it's probably better to have all that info just ready to go.
Absolutely.
Okay, and I noticed that he also recommended having your emergency contacts written down as well. One local and one family member.
Yeah, that's super
That's like your
important.
little safety net, no matter where you are in the world.
Exactly. And it's especially crucial if you're traveling alone because, you want to make sure that the hospital has a way to contact for one.
For sure. Okay, so let's say we're at the ER now.
Okay.
We've got all of our documents figured out.
Yep.
What can we expect?
Well, according to Brett, the wait times in the private ERs in Mexico are actually pretty short.
Okay, that's good.
Yeah, which is a release, but he did mention something kind of interesting.
Okay.
He said that prices are higher in the middle of the night and on holidays.
Wait, what? Why is that?
It probably has to do with staffing and demand. Hospitals have to have people there 24/7, and those off-peak hours could mean higher labor costs.
Okay, that makes sense.
Plus, on holidays, there's probably a limited number of staff available.
Right. Okay, so it's not just about how urgent, our medical need is. It's also about the time of day or the year that we need the care.
Exactly.
Okay, something to definitely keep in mind if we're
Yeah,
paying out of pocket.
definitely.
Okay, I also noticed that he brought up this thing called a credit card check-in.
Oh, yeah.
What is that all about?
Yeah, so instead of asking for like a huge upfront deposit, they'll just put a hold on a certain amount on your credit card,
Oh, okay.
and it's not actually charged unless needed.
So kind of like when you check into a hotel.
Exactly, yeah.
Okay, that makes sense. So it's a way for them to secure payment without like financially burdening the patient right away.
Exactly.
Okay, so let's say now that we've been stabilized in the ER and we need to be admitted,
Okay.
what can we expect in a private hospital room in Mexico?
Well, Brett paints a pretty decent picture. He mentioned private rooms, WA-FI satellite TV.
That's not bad.
Not bad at all, right? But he also points out some stricter rules, particularly for the ICU, so like limited visiting hours and restrictions on cell phone use.
Oh, wow. Okay, I was wondering about that.
Yeah.
Because that does seem kind of strict, especially when you're already in such a stressful situation.
Yeah, well, I mean, you have to think about it from the hospital's perspective. Their main priority is patient care and recovery. And so, limiting visitors and distractions, especially in the ICU, it helps create a calmer environment that's more conducive to healing.
Right. Yeah, that makes sense. But I bet it's really tough on both the patient and their loved ones.
Oh, absolutely. It definitely emphasizes the need for like clear communication between the hospital staff, the patient, and their family.
Yeah, for sure. And I bet that could be tricky with potential language barriers.
Oh, for sure.
Speaking of which, Brett also mentioned that while some of the staff might speak English, all of the official forms are in Spanish.
Right. Yeah, this really highlights the importance of being proactive about understanding your rights as a patient and advocating for your needs.
For sure.
Like, don't hesitate to ask for a translator or an advocate if you need help understanding something, especially when it comes to consent forms or, medical procedures.
Absolutely. Okay, so we're admitted we've got our comfortable room. Hopefully we're starting to feel better.
Right.
What about other hospital rules? What else should we be aware of?
So Brett mentioned no flowers, no outside food, and no kids under 12.
Okay, so no late-night pizza deliveries to the hospital room.
Yeah, no late night pizza, unfortunately.
Got it.
But it's a good reminder that even though you're in a different country, a lot of hospitals have similar policies in place.
Right, and probably for good reason.
Yeah, exactly.
Well, I feel like we've already covered a lot. We've
Yeah.
talked about the initial ER arrival, the admission process, and some of these unique aspects of being in a private hospital in Mexico.
Absolutely. And we've only just scratched the surface.
Right.
There's still so much to explore, especially when it comes to the financial aspects of this whole experience.
Yeah, because let's be honest, nobody wants to think about hospital bills when they're trying to recover.
Yeah, nobody wants to think about that.
But it's definitely something you need to be prepared for, especially in a foreign country.
Definitely.
So stay tuned. We're going to dive into all of that in the next part of our deep dive.
It's interesting when we talk about all these hospital policies, it's like how cultural norms and healthcare practices like intersect. What might seem strict or unusual to us might be totally standard in another country.
Right. It's a good reminder to kind of be open-minded and adaptable,
Yeah,
especially when we're navigating a healthcare system that's different from what we're used to.
for sure.
Okay, so before we get into like the financial side of things, I'm curious about this credit card check-in we talked about.
Oh, yeah.
It seems like it's pretty common in these private hospitals, but could it be like a barrier for sub-travelers?
That's a good point. Not everyone has access to credit cards or has, great credit.
Right.
So it definitely highlights the importance of like understanding these financial practices beforehand and maybe even exploring alternative payment options.
Yeah, for sure. So being prepared isn't just about having your documents. It's also about being financially prepared.
Exactly.
And Brett actually brings up a situation that I think really emphasizes this even more. He says that if you're unable to show that you can pay after a certain amount of time, you could actually be transferred to a public hospital.
Oh, wow.
Yeah.
That's a really important point. It highlights how vulnerable travelers or expats could be, especially if they don't have good health insurance.
Right, because even though these private hospitals are known for like their modern facilities and efficient service, they are still a business.
Yeah, at the end of the day, they have to make sure they can stay afloat.
Right, so if they're not confident that a patient can cover the cost, they might have to transfer them to a public hospital so they can still get treatment.
Right. It's a tough situation, but it's understandable from both sides.
Yeah.
The private hospital has to manage their finances, but the patient deserves to get the care they need.
Exactly. Okay, so it sounds like having good travel or expat health insurance is absolutely essential.
Oh, yeah, absolutely. It's a small price to pay for peace of mind.
Okay, so let's shift gears a little bit and talk about the actual hospital stay.
Okay.
We already touched on the nice amenities like, private rooms and Wi-Fi.
Yeah.
But what about the overall atmosphere and like the quality of care? What can we expect?
Well, based on what Brett's told us, it sounds like they really try to make patients feel comfortable and cared for.
Okay, good.
The staff are usually attentive and professional, and the facilities are modern and well-maintained.
That's good to hear, because it's normal to be a little nervous about getting medical care in a foreign country.
Oh, yeah, for sure.
So knowing that they prioritize the patient experience, I think that can really help.
Absolutely. And remember, these are private hospitals,
Right.
so they tend to have more resources and flexibility than public hospitals.
Okay, that makes sense. I have to admit, though, the no flowers rule is still a little weird to me.
I know, right? It's not something we see very often back home.
Yeah, why do you think that is?
Well, flowers can actually carry bacteria and pollen,
Oh, that's true.
which could be a problem for patients with allergies or weak immune systems.
Okay, yeah, that's a good point. So I guess these policies, even the ones that seem a little strange, are usually for a good reason.
Yeah, exactly. And it's the same with the outside food rule.
Right.
They want to keep everything really clean and controlled to avoid any foodborne illnesses or allergic reactions.
That makes sense, especially for those who are more vulnerable.
Exactly.
And speaking of vulnerable patients, we talked about the stricter rules in the ICU.
Right.
Like the limited visiting hours.
Yeah.
That can be really hard on families, but how can they like stay connected and get updates about their loved one?
It's super important to talk to the medical team early on and make sure everyone's on the same page.
Okay.
Designate one family member as like the point of contact.
Okay.
That way everyone's getting the same information.
That makes a lot of sense because that can avoid confusion and miscommunication.
Exactly. And it's worth asking the staff about the best way to get updates, whether it's phone calls, text messages, or even video chats.
Right. Technology can really help keep people connected these days.
Definitely. It's about finding creative ways to stay close, even when there are barriers.
Okay, so before we move on, I want to talk about Brett for a second.
Okay.
He's described as a former United States Marine, and now he's an expat health insurance expert. That's quite a career change.
It is, isn't it?
Yeah, I mean, I guess his military background probably gave him a lot of valuable skills like disciplined attention to detail and a commitment to service.
Oh, for sure. Those are all important in the insurance industry.
And, being an expat himself probably gives him a really good understanding of the healthcare challenges people face in other countries.
Yeah, exactly. He's not just talking about it, he's lived it.
Right, so it's real-world experience, not just theoretical knowledge.
Exactly. And that makes a big difference when you're trying to build trust with clients.
Okay, so we've talked about the hospital stay, we've explored some of the cultural differences, and we've learned a bit more about Brett.
Right.
But there's one big thing we haven't discussed yet, and that's the hospital bills.
Oh yeah, the dreaded financial part of healthcare.
Yeah, and it's usually the part that causes the most stress and confusion.
It is.
So let's break it down.
Okay, deep breaths, everyone. It's not as scary as it seems, especially if you're prepared.
Easier said than done.
I know, right? But Brett's got some good advice for us, so it's all about being transparent and proactive.
Okay, so let's start with insurance.
Okay.
What should people do if they're lucky enough to have it?
The most important thing is to call your insurance company right away.
Okay.
Let them know what's going on, give them all the details, the hospital, name your policy number, all that stuff.
So it's basically like filing a claim, but for your health.
Exactly. And just like with any insurance claim, the more information you give them, the better.
Right. And what about making sure they'll actually pay the bill? Brett mentioned that the patient or a family member should, push for a guarantee of payment. What does that mean?
Basically, you want to make sure the hospital and the insurance company are both on the same page about what's covered.
Okay.
You might need to give them some extra documents or, advocate for yourself a little bit to make sure everything's approved.
Okay, so it's not just about waiting for them to figure it out. You have to be proactive.
Exactly.
Got it. Okay, now what about people who are paying out of pocket? That's a scary thought.
Yeah, it can be, especially if it's something serious.
Right.
Brett says it's really important to ask for daily updates on your bill.
Really, why is that?
Well, you want to know how much you're spending.
Right.
You want to see the breakdown of all the charges and make sure there aren't any mistakes.
Oh, so it's about staying in control of your finances even when you're not feeling well.
Exactly. And if there are any problems, you can catch them early.
Before they get out of hand.
Definitely.
So again, it's about being proactive and communicating clearly.
Exactly. And remember, even if you don't speak Spanish, you have the right to ask for a translator.
Right.
So don't let the language barrier stop you from getting the information you need.
Okay, so we've talked about the bills, both with and without insurance.
Yeah.
Now what happens when it's time to go home?
Ah, yes, sweet freedom.
But Brett mentioned that the discharge process can sometimes be a little slow.
Yeah.
Why is that?
Well, first, your doctor has to actually write the discharge order,
Okay.
which basically says you're good to go.
It's like their final stamp of approval.
Exactly. And then there's the billing side of things. They have to close out your bill. So either it's paid in full or you've made arrangements to pay it.
So there's a little bit of waiting involved.
Yeah, but it's important to make sure everything's done correctly.
Right, all the I's dotted and T's crossed.
Exactly.
Okay, so you're finally discharged. You've got your medications, your instructions, and copies of all your test results. What's Brett's final piece of advice for us?
He says it's really important to read those discharge instructions carefully.
Okay.
They're not just giving them to you for fun.
Right, it's like your roadmap to recovery.
Exactly. And don't be afraid to ask questions.
Okay.
If anything's unclear or you're worried about something, just ask your doctor or the nurses.
It's your health.
Yeah, exactly.
Brett even suggests writing down your questions ahead of time
Oh, that's a good idea.
so you don't forget anything.
Yeah, it's like having a cheat sheet for your health.
Exactly. So it's all about being an active participant even after you leave a hospital.
Definitely. And it's not just for Mexico. This applies to traveling anywhere.
Right, it's easy to think that hospitals are the same everywhere, but they could be really different.
Oh, yeah, for sure, especially private versus public.
So if you're planning a trip, it's worth doing some research on the healthcare in that area.
Absolutely. Like, what kind of hospitals are there? What's the quality of care like? And how much does it cost?
That's a good point. Okay, so we've talked about a lot in this deep dive.
We have.
We've gone over what it's like to be in a private hospital in Mexico, from arriving at the ER all the way to being discharged.
Yep, we've covered it all.
We talked about being prepared, having all our documents, and knowing what to expect.
Right, and we even touched on some of the cultural differences.
Yeah, and of course we couldn't forget about the financial side of things.
Both with and without insurance.
Right, and how important it is to be, transparent and proactive with everything.
Absolutely, and most importantly, we talked about being our own advocate, knowing our rights and asking questions.
Exactly. So as we wrap up this deep dive, what's the one thing you really want our listeners to remember?
I think the biggest takeaway is that knowledge is power. The more we know about the healthcare system in a place, the better prepared we'll be if something happens.
That's a good point. Being prepared can really make all the difference.
It can reduce stress and help us make better decisions.
For sure. Well, this has been a really informative deep dive. I think we've learned a lot about private hospitals in Mexico.
Me too, and hopefully our listeners feel more confident and empowered now.
Absolutely. And if anyone wants to learn more about health insurance for expats in Mexico, they should definitely reach out to Brett LaMar or visit his website.
Yes, his contact info will be in the show notes.
Perfect. Well, thanks for joining us, everyone. Safe travels and stay healthy out there.